Good morning. So I'm gonna perform an incentive spirometry. So first and foremost, always make sure we check the patient's chart, obtain any relevant information. Once inside, introduce ourselves to the patient and explain the therapy, such as, "Good morning, my name is Anthony from the respiratory care department. So the doctor prescribed you incentive spirometry. So this one would help you expand your lungs even more, prevent your lungs from collapse, and also it would help you relieve or reduce any airway secretions present, and then this would also help them aid more cough even more." So after that, we always check the patient's ID band for confirmatory purposes, and then we make sure we wash our hands before that and wear appropriate PPE such as gloves, and then we always do our set of vital signs and pre-assessment. When doing those, every time we perform this therapy, it is really important to do auscultation, so that way we can observe especially the outcome for the breath sounds. So potential outcomes for this therapy is that it would help reduce any atelectasis, improve their breath sounds, reduce airway secretions, and also it would help improve also, by the way, their laboratories such as X-ray. So when doing this, make sure we always demonstrate in front of the patient for them to understand, and then we always inspect the device for any cracks present, and then when done, especially if I will be doing myself as the patient, we should set the appropriate setting based on its gender and its height and age. So mine is about almost 2000, so we should set this yellow thing in this side, and then if the patient just came from surgery, we can assist them, and then we can put something in front such as a pillow where it would aid and help them relieve any pain while performing this, and then we can also try to check if the patient can sit upright. If not, we can adjust the bed and assist them. First is we should hold it like this. Let the patient take exhalation away from the device until their lungs are empty. After that, insert the mouthpiece inside with a tight seal on it, with the tongue not obstructing the mouthpiece. And then, let the patient take a slow deep inspiration until we notice the white piston to rise. After that, let the patient breath hold for about 3 to 5 seconds, and then until such time the white piston would drop. Remove the mouthpiece and exhale normally. So after exhaling, put inside. So if we do this multiple attempts, let the patient rest for a few seconds to prevent any complications such as discomfort, fatigue, or even lightheadedness. And then we can also start it up with about 5 breaths per hour, until such time if they can tolerate, we can do it the ideal setting of 10 breaths per hour. And then when done, try to educate the patient if they can use this one every hour, so that it would help them exercise their lungs even more. And then should put this one in this plastic container or bag, and then the mouthpiece, they can clean it up with a sterile water. We should not soak it up with soap, and then allow it to air dry and cover it with a clean tissue. And then put it. Once done, put it in the side, and then make sure we do another set of vital signs, and then we always make sure we auscultate it, and then try to
That one has the same thing.
try to also observe if there are any improvement of the breath sounds, especially when we auscultate it. And then once everything is done, position the patient, make sure they are comfortable, try to remove this PPE, dispose it, wash our hands, and then once outside, we should also take note of how much volume the pressure the patient was able to reach. Take note and chart it, and then if the physician or the nursing charge is present, we should also make them aware for everything that we did to the patient.